We have a very special New Day Cleveland today. Love your heart.
Dr. Mark, along with a handful of other specialists from the Cleveland Clinic, are here with all sorts of advice on staying heart healthy. So let's get to it. New Day Cleveland starts right now. Good morning to you. Today we are going to help you love your heart just a little bit more, right? We have a show filled with life-saving information from the team of cardiology experts at the world-renowned Cleveland Clinic, which is #1 in heart care for the last 25 years, according to U.S. News and World Report.
That is good news, and we are joined, better news, by the best today, including our own Dr. Mark Gilinoff, who shares so much of his medical knowledge with us. And let's get right to it. This is a guy who knows all about it. Dr. Mark, how are you today?
I'm doing well.
How's your heart?
I think it's good.
Good.
Can I know for sure? Actually, pretty much, yeah. I can know for sure because I know some of my own numbers. I know my cholesterol, I know my blood pressure, I know my body mass index, I know my family history, and everyone else. You should know these numbers yourself.
So you can help guide us through that because
Yeah.
there's a few things in there I've heard before, but I don't totally understand. So I guess heart disease is one of the leading causes of death for men then.
Oh, it's not one of the leading causes. For men and women, heart disease is the leading cause of death. It is more common as a cause of death than breast cancer in women and more dangerous than prostate cancer in men. So it's the #1 threat out there. And I don't know if I can say the cool thing about it.
The cool
Let's
thing.
say there's nothing cool about heart disease.
Yeah.
The favorable thing about it is that you can control your own risk. When someone gets cancer, we all say that's terrible, but we usually don't know what causes it. We don't know what causes necessarily breast cancer, pancreatic cancer, many of these cancers. We just say, well, it happened. Heart disease doesn't just happen.
You can see it coming, huh?
Yeah, 800,000 Americans have a heart attack every year. 600,000 of them, it's the first heart attack. And in those 600,000 where we say they had their first heart attack, the adjective is always, it was a sudden heart attack. It's not so sudden. It was building over time, bit by bit by bit, and you can stop that progression right now.
It's a scary thing when you think about this, but you don't have to be so worried. I know we say these things and it starts to probably worry people, but
Anxiety
comes along with it, which we don't need in our lives, right?
There you go.
But it's something that, as you're saying, you just have to be proactive when it comes to heart health.
Yeah, I would say don't worry. Just have it somewhere on your list of things to do. Take care of my heart.
Because these numbers, I mean, some of these numbers are startling, they're staggering. I mean, when it comes to those who die from heart disease every year, that number is astronomical, but it might not have to be that way if we're taking those measures that you're going to explain with us today.
Yeah, it's more than 500,000 Americans a year die from heart disease, 647,000. It's 1 in every 4 deaths, and it's a death every 37 seconds.
Now that's a number
so.
that's sort of, that's scary
That's
right there,
scary.
right?
Every 37 seconds.
Yeah.
And my first thought is that's a lot of people. My second thought is I don't want it to be any of us.
Yeah.
And you can control that.
Now that I know that, I feel like I'm going to have a heart attack every 37 seconds.
You will not.
Thank you very much.
You will not.
I'm in the right place. We are in the right town. I'll tell you that. I think about that all the time when I travel around. You know, people. We're so lucky here in Cleveland to have so much knowledge here at the Cleveland Clinic to help us.
People travel every year from all 50 states and about 130 countries to get to Cleveland for heart care.
I know someone personally, very close to me, who just recently had a massive heart attack. The only reason I believe he's alive today is not only because he was here at the Cleveland Clinic, but also because you're innovating there. You are changing the game when it comes to heart health. They did a procedure on him that they've never done on a patient ever, and it worked, and it saved his life. That's what you do there.
Well, because we're not satisfied. We're not satisfied with how we do today. We would say, yes, we're pleased that we do well, but unsatisfied because we can always do better.
It's remarkable.
Yeah, I mean, just the way you've talked to us over the past years about things have changed just over in the past 4 or 5 years since we met you the first time. I mean, you tell us one thing, and then also, well, it is this, but now it's also this too.
Yeah, I'd like to say instead of saying we were previously wrong, we're saying instead we're adding to our knowledge. Like here is who should take aspirin. Here's who shouldn't take aspirin. Here's a new kind of artificial heart we can put in we didn't have 5 years ago. So it's not that we're uncertain, it's that we're always advancing.
I think what's great about this information too is that it's not always like a surgical procedure that's going to make you better, or it's not even a medicine that's going to make you better. Sometimes it's a lifestyle change that can be the answer to your problem.
Well, lifestyle is what prevents you from getting sick in the first place. At the end of the day, if we learn enough and get the word out such that the Cleveland Clinic is kind of empty, everyone's so well they don't need to go, that would be a victory.
Boy, we could get a good parking spot there.
You'll be able to
Finally, right?
Yeah.
But that's why we're here this hour, because it's the majority of this that we can control, we can prevent, is the lifestyle change aspect. So all hour long, we're going to be discussing some of those life-altering aspects that you can easily make to really prevent yourself from having a heart attack or heart disease.
Right, and they're not secrets.
Okay, so we're guessing you have some questions for our team out there, right? So send your heart-related questions to newday@fox8.com. And guess what? Dr. Mark will answer them live, and that's later in the show.
We can't wait for that. So he's going to be back with us. Again, we have a team of experts that are going to be joining us all hour long. So make sure you stay with us. Still to come here on New Day Cleveland on our Love Your Heart show. We're talking about heart health screenings, when to start, what your blood pressure and cholesterol numbers should be, and some new tests to predict who's most at risk for heart disease. We'll be right back. Healthy is fish oil for your heart? That answer? I want to hear this one. It's also coming up after the break.
How healthy is fish oil for your heart? 82% of people surveyed by the Cleveland Clinic said it was very healthy. Our team says this: for the general population, fish oil is not that great. If you don't eat fish, fish oil might be better than nothing, but prescription fish oil has been shown to decrease triglycerides and may help people with both elevated triglycerides and heart disease. Natalie?
All right, thank you, Dr. Mark. Heart attack symptoms, we're discussing them right now. Also, screenings is the topic of this next segment. We have Cleveland Clinic doctor, cardiologist, Dr. Leslie Cho joining us to talk about some different symptoms that women may have. So, symptoms that might not necessarily be the same for our male counterparts.
Yeah, so women have 70% typical symptoms: chest pressure, chest tightness when they're walking. But 30% of women have atypical symptoms. So they will be very short of breath, or they'll be very fatigued, or sometimes they'll say, like, I have jaw pain or numbness in my left arm, but they have atypical symptoms. So instead of going to Dr. Google, maybe the better thing.
The majority of people, if we've just become a society, just that's something that we do.
Yeah,
we just rely on it.
Instead of going to Dr. Google, go to your doctor, talk to him about your symptoms, and then, or her, talk to her or him about your symptoms, and then you can have appropriate testing. But really, if you feel like you're much more short of breath or much more fatigued than you were before with exercise, it's really important to go seek professional help.
Now, when you have certain symptoms that come about, maybe some are more imminent than others, when should you be going to the doctor? I mean, are you needing to go to an emergency room if you're experiencing some of these symptoms? Or can you, I think that people think, oh, well, I can just wait to go to the doctor on Monday.
Right, so if you have like an exertional chest pressure or chest tightness, like you walk up 3 flights of stairs and you start having chest pressure, chest tightness, and that's been going on for a while, you need to seek a professional opinion, but you don't necessarily have to go to an emergency room. But if you like wake up and you feel like there's chest pressure, chest tightness, you have that dread, you have nausea and vomiting, or you feel, sweaty, then it's time to call 911. I mean, you have to sort of use your judgment. Heart pain, sometimes people will say that it's like 15 minutes or longer. Like that's, some people just feel this incredible dread. They feel this incredible dread of something terrible happening, and you should seek professional opinion. I always tell people it's better to be safe than sorry.
I feel that
100%. Better
all
to
of
be
the
safe.
time.
Yeah, it's okay. You're not a doctor. It's completely okay.
But go to the doctor, not Dr. Google.
Right?
Yeah.
Mm.
But so, and with a lot of this, as we were just discussing with Dr. Mark, it can be preventable. And the statistics on that are also wild.
Amazing. It's 90%. 90%.
Not 19, not 9,
90. It's totally preventable. 10% is family history. So family history is your mom or your dad having had a heart attack before the age of 55 if they're a male, or before the age of 65 if you're a female. But even then, 90% of heart disease is preventable by controlling our blood pressure, our cholesterol, not getting diabetes, and then not smoking. I mean, that's so important.
It's always big. Dr. Marker's always instilled this in us. Know your numbers.
Yeah.
And when you're looking at those numbers, how often should you be checking those numbers?
So this is astounding. You know, the American Pediatric Academy recommend that children over the age of 7 get a cholesterol test.
Really?
Not to start on medicine, but just to know your numbers. And then at age 20, you should get your cholesterol testing. And then every 5 years thereafter, if you are, if you have no risk factors, but every year thereafter, if you have risk factors. It's really important to get your number checked.
So for those who may have something hereditary in the family, I know you mentioned it is just a small portion, 10% that would affect, but should those people always be making sure at a younger age they're checking?
Absolutely. I mean, listen, heart disease is preventable. That's the most fantastic news in 2020, that heart disease is preventable. And even if you have horrible family history, you can still prevent it. But how are you going to prevent it if you don't know what you have it?
Now, when it comes to, say, even blood work, I like to get my blood work done once a year.
Yeah.
Maybe that's excessive. I don't know. What is a reasonable amount of time period for people to, even if they're healthy, maybe they don't have problems, they don't have a family history, what's a reasonable amount of time?
So you should probably get your blood pressure checked every year. You should definitely have your weight assessed every year. I know women are getting their weight assessed every day, but I'm talking about, getting your weight checked so that your BMI is in a normal range. Also, if you are a smoker, it's really important to see a physician. Because there are some ways to stop smoking that they can help you with. But cholesterol screening once a year if you have risk factors, but every 5 years if you don't.
Oh, so I maybe could tone it back a little bit, which is good to know, because I think there are a lot of you out there who are sitting on your couch, sitting in the chair and watching and thinking, I don't know when, maybe I'm not doing enough or maybe I'm doing too much. You're helping us sort through all of this.
Well, it's important to get your cholesterol checked at age 20. I think that's the most, and then every 5 years thereafter. Now, a lot of women don't go see their doctors, their general internal medicine, they go see their OBGYN.
And so they're more focused on the gynecological side of things and making sure, which is great, but they're maybe not taking care of themselves as well when it comes to heart health.
Absolutely, and it's the #1 killer for both men and women. So it's really important to know that so you can do something to prevent heart disease.
Ladies, take care of yourselves. It's time for us to do that, right? I appreciate you coming in, Dr. George.
Thank you.
Such a pleasure to meet you.
Thank you so much for having me.
All right, David.
Coming up on New Day Cleveland, Love Your Heart. Lifestyle changes that make a huge difference to your health. We'll share info on a free walking program that everyone can take part in. And how about this? How healthy is diet soda for your heart? Stay here for the answer.
How healthy is diet soda for your heart? Diet soda is not healthy for you. 74% of people in our Cleveland Clinic survey agreed. Research shows that diet soda has been shown to increase your hunger. David?
So much for the sodas today, folks. Okay, it's all heart info all hour on the special Love Your Heart edition of New Day Cleveland. And next up, it's about exercise. You may not want to hear it, but it's a life changer when it comes to cardiac care. That's why Dr. Eric Van Eiderson is here. He's the director of cardiac rehab at the Cleveland Clinic. And what is cardiac rehab? And is it just for people who've had a heart problem or a heart procedure?
Yeah, well, that's an excellent question. And that, to put it simply, you can think about it as prescribed exercise as medicine. And it really is meant for individuals that have had major cardiac events such as a heart attack or open heart surgery, but realistically, all the things that are involved in cardiac rehab, anyone can do.
Yeah, I had a procedure, and after the procedure, they took care of me and watched me very carefully as I sort of proceeded, sort of grew slowly through the program. So that's the way you go about it then. It's not about running a marathon.
Yeah, absolutely, and that exercise has to be very individualized and specific to your medical history and what you've recently experienced, and that we do know that even after a heart attack, doing mild to moderate intensity exercise is recommended, and that the alternative of not doing exercise can cause more damage long term.
So I see some folks on a treadmill right now, and we're talking about preventative care too. So before having a procedure, if you're on the way to maybe someday, if you don't take care of yourself, you can prescribe somebody an exercise routine to keep them maybe out of harm's way then.
Absolutely, and I would highly recommend doing primary prevention and looking at exercise as medicine as one of the key tools to help you decrease the risk of cardiovascular disease and heart-related issues, in that you can come in to the Cleveland Clinic or another institute and get an exercise prescription involving exercise stress testing, as well as a one-on-one discussion with an exercise professional.
Yeah, one thing I noticed when I went to Cleveland Clinic for that is it was less money to go there with the professionals watching you and guiding you than it was to join some of these health clubs.
Yeah, absolutely.
So that was a miracle to me.
Yeah, absolutely, and that's the benefit, is that those individuals are trained to know not just exercise, but they're trained to understand the safety components and how to make exercise the best for you.
Yeah, so how much exercise do we need? I mean, there's 1,000 ideas about that, right?
Excellent question again, and that for almost any individual out there, 150 minutes per week at moderate intensity is recommended, and that is not just in a single day, but sprinkled over those 7 days of the week is how you get the best results.
So I heard somebody say the other day that you could exercise 5 days a week and it's okay, but I just heard you use the number 7 days a week. 7 days a week better than 5 days a week?
Well, absolutely, in that if you think about exercise as medicine, you want to get your dose on a consistent basis, and there are 7 days in the week, so there's no reason why you should take 2 days off.
So let's talk about some of the heart benefits of exercise. How does, I mean, you're a person that hasn't exercised most of your life, and now all of a sudden you're like, say you're 50 years old, could have problems. What are the benefits, and how fast does it happen?
Well, the primary thing, of course, is looking at it as a whole body benefit, in that it's not just your heart, but it's your entire cardiovascular system. You can also feel the benefits of increases in strength, increases in endurance, lesser fatigue, maintain bone health, but that you really shouldn't look at these things as immediate gains, and that it does require repetition and consistency with exercise to get the greatest benefits.
Everyone always says, I feel so much better, I sleep so much better, so it's the whole body.
Absolutely. It shouldn't just be looking at improving heart health, but the entire cardiovascular system, how you breathe, your quality of life, your ability to do activities of daily living.
Okay, people are watching out there right now and they're going to go like, okay, I'm going to start exercising. It's almost like January 1st, right?
Yeah,
Everyone's going to
absolutely.
start doing it. But when you start exercising, you need a little bit of medical, you have to know something about what your body's doing right now before you start something that could be strenuous and hurt you, right?
Yeah, absolutely. And that if you have some risk factors, such as you're overweight, or you have a family history of heart disease, or high blood pressure, I do think it would be best for you to talk to a professional, such as your cardiologist, and or come in and speak with a clinical exercise physiologist to discuss your risk in terms of how much exercise is too much and how much exercise is the best for you.
And when you come to the clinic to do something like that, I mean, they'll put a heart monitor on you, they check your blood pressure before and after you exercise, so you get some real like measuring points, right?
Yeah, absolutely. We'll do actual diagnostic testing in terms of evaluating how your body responds to different levels of stress, evaluate the safety, also then provide you with individualized recommendations via exercise prescription.
Have you exercised yet today?
Well, absolutely. First thing in the morning, right?
There you go. Thank you very much.
All right,
Great,
thank you very much for having me. Thank you.
great to have you.
Thank
Dr. Mark?
If you need a little motivation to get moving, this group may help. Meet the Soul Steppers.
Celebrate sisterhood, Soul Steppers!
This free Cleveland Clinic walking program is helping people change their lives. Cleveland Clinic gynecologic surgeon Dr. Linda Bradley started the program in 2018.
We know that walking also increases your heart rate a little bit, helps to lower your blood pressure, helps to make you not as hungry, so you're less likely to eat as much, helps you to lose weight, and if you've been lucky to lose weight, it helps you to keep your weight off, improves your cholesterol, and overall helps you with sleep and also improving your mental health.
Soul Steppers to me is like a sisterhood. You can get up and get out and meet good people, good ladies, you know, and get some little exercise in.
Danita McKenzie heard about the program through the Cleveland Clinic's website. It has inspired big changes for her.
For 1 year, I have lost 48 pounds. Yeah, so yoo-hoo. So my challenge was to lose a pound a week. That was my challenge. I'm trying to eat right. I'm almost vegan. I've almost gone vegan. Yeah, I still like honey and eggs though. Yeah, we share experiences and recipes and, you know, try to help each other stay on track.
My blood pressure is lowered. I'm losing a little weight, but I still got a little more to go. So
Deborah Rice is another Soul Stepper.
I get to meet a lot of people. We talk about current events, healthy meals, what we can do to lose weight. So I'm having a ball. I run volunteer services and patient guest services at South Point Hospital.
You could say Carolyn Sanford is the heart of the Soul Steppers.
It's a great program. One of the things that you will find out that our community is very much invested in supporting each other and wellness, and nobody supports that more than Cleveland Clinic. I call them the Legos because they're all different ages, size, health status, but when you put us together, we all click.
The Soul Steppers walk on Wednesdays from 6 to 7 p.m. and Saturday mornings 9 to 10 a.m. In good weather, the group meets at Cleveland Clinic South Point Hospital and in the colder months at the Warrensville Heights Recreation Center. For more information or to register, visit clevelandclinic.org/soulsteppers, or you can call or text 216-408-6389.
You don't have to be alone. You go at your own pace. And I've also seen ladies that came in here on canes that are walking now. So that's beautiful.
Sometimes folks bring their grandchildren or their children with them because they're babysitting and they want the kids to also get exercise and disconnect from the electronics for a minute. So they can bring them and they're welcome. We encourage our men to please join us. We have a few.
It's free. Show up. I'm a part of what I call the gentle walkers. I'm not as fast, and so people, it's not a race. It's just to come, enjoy. Some people have come and could only walk around one time. And as the weeks and months go on, they're happy, we're high-fiving each other. My God, Dr. Bradley, I'm now doing 3 laps. So, do what you can, come when you can, and you'll have a great time.
For Fox 8, I'm Dr. Mark.
Love what you're doing there, ladies. All right, coming up on New Day Cleveland, Love Your Heart, heart-healthy foods the kids are actually going to eat. They're going to love this stuff. Plus, we're talking about how healthy are e-cigarettes really for your heart. Dr. Mark has the answer when we come back.
How healthy are e-cigarettes for your heart? E-cigarettes are not healthy for your heart. 86% of people surveyed by the Cleveland Clinic knew this. No smoking of any kind is good for you. But what do smoking and vaping actually do to your heart? Here's the latest information.
Vaping is just the use of liquid that most of the time contain nicotine or THC that it's hit up by an electronic device.
Dr. Umberto Choi is a pulmonologist at Cleveland Clinic. While we know vaping has negative effects on the lungs, we're learning about how it may affect the heart as well.
This is one of the unknowns. Vaping is still something that is very recent, has been around for a few years, and now we are learning more and more about the short-term effects of vaping in the lungs, and there are some studies showing some evidence that it can affect the cardiovascular system, but these studies are preliminary. We definitely need more research, more data, and probably more time to see what the true effect is in the heart.
We do know that smoking is very bad for your heart.
Cigarette smoking is associated with multiple forms of heart disease and also lung disease and cancer. In the heart disease, the major forms of a disease that are associated is coronary artery disease, which can lead to heart attacks, for example.
Nicotine increases heart rate and blood pressure. Carbon monoxide in tobacco and cigarettes decrease the amount of oxygen that goes to your heart, brain, and arteries. Smoking also damages blood vessels and makes blood sticky, which can lead to blood clots. When you quit smoking, Choi says you can expect improvements.
There's benefits in improving the blood pressure, for example, improving someone's heart rate, and down the road there's long-term benefits of helping to decrease the risk of developing heart disease like coronary artery disease, or having a stroke, for example, or developing heart failure down the road. But the more immediate effects are, improving somebody's cough, somebody's well-being, maybe feeling more energetic, having that taste back. A lot of people who smoke lose that sense, and they gain that back after they quit smoking. But for the heart, it's just mostly improvement of the heart rate and the blood pressure, and down the road decreasing the risk of developing heart disease.
Quitting can be difficult for both smoking and vaping.
Most programs are the same. I think overall we call them a smoking cessation, but now it's more a nicotine dependence treatment that can be related to cigarette smoking or vaping. Most people try by themselves cold turkey, but it's something really hard to do. Most people try multiple times, but they should know there are medications out there are professionals out there who are specialized in helping people who have dependence to nicotine. So there's a nicotine replacement treatment, there are other medications that can be prescribed, so they can try by themselves, but it can be hard, so there's definitely help and a lot of options for them out there. And we definitely have a program here at Cleveland Clinic, so we can offer that kind of treatment as well.
Some great tips, great information there. It really is staggering here because it turns out that 1 in 5 Americans believe that vaping is not harmful to heart health, and 1 in 10 don't believe that smoking cigarettes is unhealthy. That's according to the most recent Cleveland Clinic Heart Healthy survey. So what everyone seems to know, though, is it is hard to quit, very hard for some people, but you don't have to do it alone. Christine Adams is joining us. She is a certified nurse practitioner at the Cleveland Clinic. I think it's very important because it is so difficult for people to know that they have to have the help to back them.
Absolutely. Particularly when we see patients as it relates to vaping, the nicotine content in vaping is so much higher than in cigarettes that the withdrawal can be very uncomfortable. So we have ways to mitigate those withdrawal symptoms with medications and behavioral tips and therapies. So we encourage folks, it is hard to quit smoking, even if it's cigarettes. If you've known anybody who's tried it, they'll tell you it's the hardest thing they've ever done. But in particular, folks who are struggling with vaping and getting off of that, we have certain strategies that we can help with that at the clinic.
I want to go back. Is that common? I mean, I didn't know this, that vaping has more nicotine in it than cigarettes.
Yes.
Is that, I mean, that's startling to me too.
Well, the thing about vaping, it's so new on the scene, and it's really common in high schools and in colleges. That's mostly where we're seeing it start. Now, they can purchase anything off the internet anymore, and you don't know what's in it. So if you are coming in to be treated for vaping and coming off of that, I recommend you bring the packaging with you into the office so that we could take a look at what is exactly in there. Sometimes there's added oils. Sometimes too, the lithium ion battery creates such a high heat that we're seeing lung injury right away and are having to treat patients right in the office for that. So it's really important to just be very open with either your nurse practitioner or your primary care physician to tell them where you're getting the vaping supplies and how much you're using so that we can really help work through that with you.
So this is all part of, it's a smoking cessation program.
Yes.
So what all does that entail?
So we have a really robust program at the Cleveland Clinic. Anybody who wants help, we're glad to offer it in many, many forms. For folks who work, our virtual visits are a great option. They can just use their cell phone and contact one of our primary care providers or our nurse practitioners who deal with smoking cessation. Some people like a group therapy sort of route, so we offer shared medical appointments where other people are struggling with smoking. We offer classes once a week throughout the communities so that it's always close to home. We also have a whole army of pharmacists who will help prescribe medication and help manage side effects to quitting smoking. So really a lot of options. I think you'll put it out on your website, but it's clevelandclinic.org/stop smoking. Will direct you to all the areas you need to go to.
I think it's remarkable because a lot of people out there might want to try to quit, but they do feel like they're doing this alone. What you've just said, clearly there is an entire team of people that will have your back getting you through this. You mentioned medications earlier too. What types of medications do people normally go on?
Yeah, so really effective medications. Our first line therapy is varenicline, also known as Chantix. It's twice a day dosing. What patients tell me, it's really kind of interesting. After they've been on it for, it's usually around the 21st day, they'll say, I just didn't feel like smoking anymore. I just put it down. And people who've smoked 60 years, this really is effective. What I then tend to do is keep the patients on it for a year after they quit so that they don't have that relapsing issue. A lot of patients have heard about side effects with that medication. We have ways of mitigating that and working through that in the clinic, so don't let that be a barrier to starting it. We also use Zyban or bupropion. Does work for some people and helps them quit smoking. And then, of course, we have nicotine replacement therapy to help mitigate the withdrawal symptoms of nicotine.
So, and that's, I think, also something to touch on even further, because you're saying that a lot of people, some people might try to quit cold turkey.
Yeah.
And if you can, great.
Great,
But
yeah.
if you can't, and I think probably a fear for people is that the side effect is what's going to happen with the withdrawal symptoms.
Yeah.
But they might still experience some, but what you're doing is really going to lessen that so
Yes.
much.
Yeah, yeah, and you know, it is bad for the first 3 days. I just always tell people, if you can hang on for the withdrawal symptoms for the first 3 days, those are the worst. And then after 2 weeks, it should be gone. So if you can just hang in there, we'll get you past it. And in addition, I want to mention we do have e-coaching. These are folks that can help keep patients motivated to quit. They contact you. It's very, non-confrontational, just a cheerleading section
That's
for
wonderful.
you. They go email, text, phone, whatever is most convenient for you, but to really just keep you motivated and keep you on track.
That support system is absolutely there. I can't thank you enough for coming in. I hope
Sure.
we touched some people out there who might be struggling with this today. So thank you for
Thank
being
you.
here. All right, David?
Definitely a lot of good information out there. And if you have questions for Dr. Mark, just please send them to newday@fox8.com. And guess what? He will answer some of them later in the show. And heart healthy eating. That's right, we're in the kitchen. We'll find out how healthy eggs are for your heart also. Stay here for the surprising answer.
How healthy are eggs for your heart? 74% of those surveyed said they were very healthy. They were right. Eggs are good for you. Egg whites, you can have as much as you want. But if you have high cholesterol and heart disease, you should limit the amount of egg yolks that you eat. David?
Okay, how about some good eating habits? They start early. So today, Cleveland Clinic dietitian Jen Highland is here to show us some heart-healthy food ideas that everyone, even kids, will try. What is the heart-healthiest snack out here today?
Yes, we're going to talk through it. So when it comes to heart-healthy snacks, we want to look for low to no added sugar, low saturated fat, high fiber.
How do we know we're getting that?
Yeah, so fruits and veggies are going to be a great way to do it, and then we'll talk through some of them today.
Okay.
So, here, the first one, we have some apple chips. So I don't know if you've seen these before, but instead of regular chips or just instead of plain fruit, ways to get fun things in, yeah, give it a try. So you're gonna cut the apple, you just slice it, you pop it in the oven. It's so easy. Roast it low, 200 degrees for a couple hours. A little bit of cinnamon.
And when you're trying to get away from sugar, you crave the sweet thing?
You do.
There's really a big sweet
Yeah,
component
the
to
apples
this.
are the sweetness, and you can do a different variety of apples, so they'll taste a little bit different.
Probably
And
do pears too if you want to.
yeah, you could do anything. We have strawberries here, so we have freeze-dried strawberries. You could make those yourselves.
So you would use that as like a snack between meals or part of a meal, or
Absolutely.
how
It
would you
could
do
be
it?
either. So a snack between meals would be great, especially when the kids just want something to crunch on. And you can purchase them in these bags here, but they're so much cheaper, easy to make yourself. Smells really good as they're cooking in the oven.
So we have the dried ones and we have the real ones here.
Yes.
Anything wrong with the real ones? Or the real ones are good
Absolutely
too?
not. Real
Okay.
ones are great too. Yes,
Good.
put a little protein with it, you're good to go.
Great.
Yes, and then another thing we want to focus on is heart healthy fats. So, we hear low fat when it comes to snacks, but not all fat is evil. And we want to make sure that, especially for kids, we're getting some variations in. So tuna is an awesome, I know maybe not the most exciting, but believe it or not, I have a lot of kids in clinic who like it. But yeah, so we don't want to just do we don't want to do animal fats, but the plant fats, we still want to get some tuna in, some fatty fish, some salmon. Those are going to give you different type of fat. It's processed differently in your body, and we need to get that in.
Because we were talking about fish oil earlier, how
Yes.
some of those products are not really very good for you
Right,
unless you
fish,
find
fish
yeah.
is the best way to do it. So if we can get
real
fish
thing.
a couple times a week, we can make a healthy tuna salad. You can quickly do tuna, mix it with avocado even, mix it with salsa, bunch of different ways you can do it.
And you really need these oils to make your skin stay nice.
Absolutely.
The suppleness
Yeah,
of your
olive oil, avocado oil, walnuts are an excellent source of omega-3s, so anything like
and
this.
talking about this right here.
Yeah.
Okay, so you got the tuna, it's good stuff. What do you want to put in it that you shouldn't put in it? I mean,
Yeah, so mixing it with a lot of mayonnaise or saturated fat isn't going to be ideal. So we can try avocado, you can try a plain fat-free Greek yogurt. There's a lot of different ways to dress it up. They have some flavored tuna packets even where you could just eat it straight out of the bag. It's a super portable snack, so that's a great option.
how about peanut butter and nut butters?
Amazing, yes. Peanut butter, nut butters, wonderful.
Sometimes you ever see those little Mary Jane crackers, or they're almost like cardboard or something, but they're pretty good.
Yeah.
Can you eat
so
those?
Absolutely, a whole grain cracker, a veggie. You can cut up bell peppers, anything like that for a dip. With the tuna salad, that'd be an awesome choice.
Right. So here's old school right
and
here.
here's old school, yes. So we
Right.
cannot talk about heart-healthy snacks without talking about vegetables. So, but we have to find a way to make it fun for the kids. So a dip is always going to be a great option, and having a variety of just raw cut-up veggies is great. And then what we did here is we made a little bit of a heart-healthier version of a ranch dip.
It's cute.
Yes. So, and putting it in fun cups for the kids. These are little hearts. Any way to kind of get them to do
So
it.
how exactly do you make this ranch dip?
Yeah, so it's super easy. So you have plain fat-free Greek yogurt right here. It also gives them some protein with the snack to help keep them full.
Fat-free?
Fat-free. We don't want to do a lot of animal fats. We want to be doing more plant-based fats, aside, of course, from the fish, like we talked about.
Right.
And then you can do simply a ranch packet, or you can make it yourself. You can do garlic powder, onion powder, a variety of different spices in there. They can make it themselves. It can be a fun dip for the kids.
When you stay away from the mayonnaise, you're 100% better.
Well, it's a better option. Yes,
Yeah,
it's a better option. So
this looks pretty bizarre.
Yes, so this is our fun section here that we're using beans and chickpeas. So high fiber, which is going to be extremely important when it comes to heart health. Give it a try. This is a cookie dough.
Wow.
Chickpea based. Yes. So here we have chickpea cookie dough. So it's chickpeas, nut butters, super heart healthy fats right there. High fiber, going to keep the kids full as well. And it's tricky, right? It tastes like cookie dough, but you still get the good benefits from it.
It's freaky hummus.
Freaky hummus, there you go. With some dark chocolate in it, which is also going to be good for the heart. And then here we have...
That's surprisingly great.
Isn't it?
Yeah.
Yeah, it's interesting. You might not even know if you didn't know about it. And it's so easy.
It's probably not good to eat that whole thing, though.
It's a lot of fiber, so you might have a little bit of tummy distress in that case. But otherwise, it's super healthy for you, yes.
Okay.
And then we have some black bean muffins. So chocolate muffins here look just like chocolate muffins, but they have black beans in them. So again, higher fiber, lower sugar, going to keep the kids full. Make them, pack them, super simple.
So the black bean muffins, how did we make them sweet? What do we do?
So they're sweetened with a little bit of maple syrup, but then we have some cocoa powder in there. We have some Greek yogurt in there. So it has a variety of different textures and flavors to it.
They're pretty good looking. Let me try one.
You can just pick it up if you'd like. All right, yes, some chocolate chips on the top.
It's dense, but
Little
it's really
sweetness.
tasty.
Yeah, it's good. And again, you can make them ahead of time, pack them, portable, super easy. Kids and adults will both like
You're
them.
going to give us the recipes for these, right?
They're all online. Yep, you'll have them.
Very good. Thank you very much.
Yes, thank you.
I feel better already.
Awesome.
Madeline?
Send one over my way. Those look
You
good.
got it.
I'll take one too. All right, we will have more important heart health information when we come back. Your questions answered by Dr. Mark. And how healthy is red wine for your heart? Listen up, folks. The truth after the break.
How healthy is red wine for your heart? 72% of people in Cleveland Clinic survey said it was very healthy. The expert answer? If you don't drink, don't start. If you do drink wine, red and white are actually equivalent, but only about 6 to 8 ounces per day. But if you do have a triglyceride problem, the alcohol has to be limited.
So white and red are the same. Everyone always says, oh, red's healthier for you. Get rid of that
They're the
information.
same. The active ingredient in red and white wine is the same as the active ingredient in beer and vodka. It's alcohol. Alcohol in small doses is neutral to good for the heart.
All right.
Neutral to good. I like that.
I'm not going to give you a prescription for it. It's not that good.
That would be
beautiful.
nice, right?
Yeah.
So thank you for being here all hour with
My
us.
pleasure.
And I know there are a lot of you that wrote in. We had a lot of questions coming in for you, so we're going to try to condense some of them so that we get to as many as we can. The one thing that people brought up a lot was dealing with depression and anxiety.
Depression and anxiety are, of course, problems in their own right, but depression in particular has a link to heart disease. A substantial percentage of people with depression get heart disease, and a lot of people with heart disease get depression. So my thinking is this: if someone's got heart disease or depression, screen for the other one as well.
Yeah, because anxiety could be a problem. If you have a heart problem already, anxiety it sort of compounds the problem, doesn't it?
Oh, it absolutely does. And anxiety is not going to make somebody who has no heart problems have a heart attack.
Right.
But if you've got the substrate, meaning on the inside, things aren't quite right with the plumbing, and you have anxiety or depression, that can trigger heart problems.
Anxiety and depression really do affect so many things.
Oh,
so
super
it's really
common.
good to keep
Super
Anxiety,
keep
get
that in
pulse
check.
changes and
Yeah.
blood
Of
pressure
course,
changes,
of
all kinds of
course.
stuff. Somebody talked about plaque scans for the heart. This is a question. How accurate are they, and who should get one?
These are commonly called calcium scans, looking for a plaque in the heart. And I see billboards advertising them all over the place. On the way home from the airport, for example, don't get those just on your own. Don't go write a check for $500 and get a calcium scan just because. Most people don't need them. If your cardiologist or doctor says you have risk factors for heart disease, and I recommend it, get it. But otherwise, don't spend your Christmas present money on a calcium scan.
Okay, good to know. We don't extra money going to waste there.
Yeah.
High blood pressure, people deal with that a lot. When it comes to getting in the doctor's office, making sure they're doing the right things for themselves, that was a #1 thing people were bringing up is how do I deal with my high blood pressure?
First thing with blood pressure is to know your blood pressure. Can't tell what it is unless you get a blood pressure cuff, put it on, and get the number. A lot of people have what we call white coat hypertension. White coat meaning the doctor's coat.
It's
so you go
always
into
higher
the
at
doctor.
first when you sit down,
yeah,
right?
It's higher at the doctor's office. It turns out people who have white coat hypertension are a little bit more prone to getting what we would call real high blood pressure or hypertension. How do you know? Buy yourself a blood pressure reader or a cuff. You can get this practically any store. Take your blood pressure every evening. Evening, not morning. Blood pressure is higher in the morning. Take it in the evening, same time of day in a quiet room, write it down, do that for a few days in a row, and see what your blood pressure is. That's the best index of what is your blood pressure.
Interesting there.
A lot of people are talking about diet. You know, diet can influence how your body works and what's going to happen. Sometimes when you change something too quickly, you get other uncommon results. How about that change, like when you change your lifestyle really fast? Are there dangers in doing that at all?
I'd say the only lifestyle change to make really quickly is quit smoking.
Yeah.
That's a good one. Otherwise, you're going to be more likely to stick with a new lifestyle if you adopt it gradually. So don't just suddenly right today change your diet. Let's say you love salt and you have high blood pressure. So if you have high blood pressure, salt is bad for you.
Right.
Start cutting back till you get to a reasonable amount. But you're right, changing abruptly often doesn't stick.
Yeah. Exercises like that, talking to the doc, you know, you got to start that sort of carefully.
Yeah, don't go out and run a marathon. No one could anyone. Anyway, but go out and walk a mile.
Yeah.
There was something else, we brought up fish oil earlier in the show, and a lot of people then have wondered and asked the difference between over-the-counter fish oil and the prescription fish oil. So I know you're not huge on them altogether, correct?
Oh, I'm less than not huge.
Okay, all right.
For over-the-counter fish oil, just throw it out. Absolutely worthless. There's no indication whatsoever to use over-the-counter fish oil supplements. They don't do anything. If you want to have fish oil, eat a piece of salmon.
Yeah.
For some people, prescription fish oil is useful. Prescription fish oil is different, it's much more potent, and it's only useful in a small group of people who have heart disease, have elevated triglycerides, and get the prescription. Over-the-counter fish oil that you see in the supermarket, drugstore, don't buy it.
You know, it brings to mind to me, you know, a lot of times you find out your heart's not quite right or you need to change your lifestyle, so you want to lose weight. So how about people that are trying to lose weight by using over-the-counter diet aids? Could that be dangerous for you?
It can be dangerous. They don't work very well, and it is hard to lose weight, but the recipe to losing weight is easy to understand. The recipe is eat less, exercise more.
Yeah.
The pills, they just don't work in the long term.
So there was someone who wrote in too, and I want to read this, make sure I get this right. So they said that they're on medication for high blood pressure. It's now regular levels, so am I still considered to have heart disease?
You still have cardiovascular disease, meaning you have high blood pressure, which is treated. And by treating the high blood pressure, you reduce your risk of heart attack, stroke, and other bad things. So yes, you still have an issue, but you have an issue that's being treated effectively.
A lot of information that we got through today, that is for sure.
Yeah.
A lot of great information.
And of course, if you missed some of the info on today's show, don't panic because we put a list of resources together on fox8.com. Just go there, just click on the New Day Cleveland tab, and you'll find the general heart information as well as info on quitting smoking. We got the Soul Steppers free walking group we told you about, and of course the healthy, heart healthy recipes.
We're so blessed to have you here, Dr.
And we had him all.
Our team here. It was a wonderful show today. You really helped a lot of folks out, so we thank you.
Oh, it was my pleasure. It's fun to be with you guys.
Don't be anxious.
We love seeing him
Have
in a
fun.
suit, too.
Live right.
Fun.
That's
White
right.
coat, suit on.
Looking good. Thank you.
Thank you.
I want to make sure we get